What up, people? It is your boy C. Grant. Welcome to another episode of the Guy Talk Pod, where we are honest, open, and transparent. We have a great, awesome guest with us here today. We're going to dive into some health aspects for our men to hopefully educate you guys, hopefully bring some awareness to you around this particular topic, and hopefully really encourage you to get seen, checked, annual visits, monthly visits, whatever you need to do to ensure that you have not only a quality of life, but also a longer lifespan. So we are awesome, and this is going to be an awesome episode, y'all. I'm excited. I was just telling our guests that we are looking to really educate men in so many different ways around this. So I'll shut up and I'll dive right in. First, we'll get to the introduction of our guest, Dr. Garland Green. Good morning, sir. How are you?
I am great. How are you?
I am well. Thank you so much for coming on with us today. We are looking forward to a great conversation. And I know we hear a lot about cardiology and cardiologists, and really want to talk to kind of what that role is, or what that looks like in terms of what a cardiologist is for those who don't know. But also, we're going to talk on a few areas of who does it impact, right, in terms of age perspective and race perspective, et cetera, et cetera. But we always start our episode off, Dr. Green, with a scripture. Today is no different. And this one is, I don't know why it's in my spirit, the word awesome. Today was going to be really awesome because I was about to say that again, y'all. But nonetheless, today's scripture is Proverbs 4:23. Above all else, guard your heart, for everything you do flows from it. And I felt that was just so applicable to our conversation today as cardiology. At least, I don't know everything about cardiology, but at least from my understanding, it obviously deals with the heart and the circulation, blood flow, etc. Can you tell our audience, Dr. Green, kind of what exactly is our interventional? Or is that you are an interventional cardiologist, right? And what exactly is that for those that don't know?
First of all, cardiology, like you mentioned, is really studying of the heart.
Okay.
We treat all forms of heart disease, okay? Within heart disease, there's so many different aspects to cover. And so cardiologists actually have divided themselves into multiple specialties within the specialty. So if you understand, I like to use those scenario that the heart is like a house, okay? All the components that a house has, so does your heart. There is the wall of the heart, or the walls of the heart. Same the way a house has the structure that keeps it together, the strength of it, okay? We have doctors that specialize in treating those type of ailments like heart failure. We also have the electrical wiring of the heart, same as you have electrical wiring of your home. And we have doctors that specialize in that, and we call them electricians or electrophysiologists. Okay, we also have the plumbing, and the plumbing of the heart is the blood vessels that flow to the heart and give the heart its blood. I'm a plumber. Okay, I'm a plumber. So what I do is I focus on number one, trying to prevent those clogs or blockages from happening to those pipes or to those blood vessels. And if you do, in fact, develop one, then I can utilize special techniques that people would know of, like balloons and stents and different other technology like that, to open up those blockages or unclog the pipes. So to try to make it simple, we have we have folks that specialize in all those areas, and my area of specialty is unclogging arteries.
Gotcha. So is that when a person or individual's heart is clogged, is that a sign of heart disease?
Well, that is heart disease. There's a form of heart disease. And just like every one of those things that we talked about are forms of heart disease, and they manifest in different ways. And so what we do is we try to assess what your symptoms are. And then once we assess what your symptoms are, then we try to figure out which one of those things is going awry. Is it your structure? Is it your plumbing? Is it your electrical? What's the problem? And then we focus in on that area and try to treat that.
Wow, that's awesome.
Mm-hmm.
So how does one get heart disease?
Well, we'll talk about mainly because most people talk about risk factors. It's really risk factors for developing blockages. So that's the main thing that I do that we'll focus on a good bit. Is so there are five major risk factors. One is diabetes, which is everybody knows is an epidemic of diabetes even in our youth. We see a large epidemic of diabetes largely because of a large epidemic of obesity. And so those two things kind of go hand in hand. So that's one of the major risk factors. Another one is hypertension or high blood pressure, which is very prevalent. Not any of us don't know a person that has high blood pressure.
Yeah.
And most of us do. And when you get to a certain age, then there's high cholesterol. A lot of that's driven by some of the diets that we have here in Louisiana. We tend to consume a lot of stuff that will elevate your cholesterol. So it's a lot of lifestyle driven, as well as some people have some genetic, factors that cause them to have elevated cholesterol. And then the two I like to always say for last, because one of them, I call it the most modifiable or the most changeable risk factor: smoking. Quit smoking. You can change that one. You can alter that one by doing that. What I would tell smokers, though, is that it's going to be the hardest thing that you've ever done because it's very difficult. It's like any other addiction. It takes a lot of work and commitment to break that habit, or should I say break that addiction, because it is truly an addiction. And the last one is the one you can't change, the one that you can't do anything about: family history. I always tell folks, you can't pick your parents. You got what you got. The most important thing in that realm is to know what they had.
Yeah.
It's always been taboo in the African American community, to talk about illnesses. A lot of times you never knew what your grandparents or great grandparents died from because it was something that we just didn't talk about. People were very secretive about their illnesses. I don't know. Somehow it's a perception of weakness, or it's just nobody else's business for whatever reason. But what I always tell people is, you say, you know what? I don't know what to pray for, but I don't know what's wrong with you.
Yeah.
So you kind of give me something to target. Your prayer needs to be specific. It needs to be targeted. And so that's the way you can a lot of times get people to divulge information that they ordinarily might not, because you need to know that. But just really have a talk with your parents. Find out, what do you have? What type of medicines are you taking? What do you do when you go to the doctor? What are they telling you? You gotta, sometimes you ought to go with them.
Yeah.
If you can, so you can really find out, what are the things that are prevalent in my family? What do I need to be watching out for? And you also want to know at what age did these things onset, because you want to try to start preventing these things and treating these things as necessary earlier than the time that person in your family had it. You got to be very proactive in trying to figure that out. If your dad had a heart attack at 50, then you need to be getting checked at 40, because you need to start doing the things for prevention. What did it say about an ounce of prevention is worth way more than a pound of cure? So that's the way we try to target things and focus in.
What has been, this is so good. What has been, well, I got a couple of things. The first thing I'll say is that we're honest, open, and transparent here at the Guide Talk. I am a former smoker. I was addicted to Newports, Newport shorts. That I call myself winging off by starting to smoke Cool Dogs, which was a joke, fooling myself. But I'm nicotine free a little over 2 years now. I make right at 2.5 years now. And what you said is very true. It was hard for me to quit. It was very hard for me to quit. I was telling folks I quit, told my wife I quit, my fiance at the time, and then later on my wife. It was so bad, I had got to hiding cigarettes up in the trunk of my car because she had found it in my armrest. I thought you stopped smoking. Or you're going to go to an early grave, yada, yada, yada. Oh, okay, this is my last time, baby. That urge will come on, or maybe something that, as smokers, if something makes you mad, nervous, whatever, that's an excuse to smoke a cigarette. So I would then begin hiding them in the trunk. And I'd smoke them, and I found it, Dr. Green, I had found this little remedy that no one would know I had a cigarette. Two things I would do. I would, have my cigarette. I would eat chocolate in terms of for the breath effect. And I would combine Palmer's cocoa butter, lotion, and sanitizer before my arms, hands, shirt or whatever. And no one knew that I still had this addiction.
Right.
But
I bet you had some smooth hands, though.
I had some smooth hands,
When another man shook your hand, he said, man, okay.
He's very hygienic guy. But I started having, like, different things in my chest that I started feeling. Like, it felt like I was having, like, papillations, I think is the right word. Maybe, yeah, in terms of, like, I don't know because I'm not as educated in the cardiovascular space, but I knew something wasn't right, So I began cold turkey, and just piggyback on what you said, it was the hardest thing that I had ever done. I'm so glad I did it. Over time, I still got urges, but I was able to pray through that. I really gave the addiction to God, saying, God, I can't do this without you. I've tried on my own. It didn't work. I went from Newports to Cool Miles. That was my strategy, thinking I was doing something.
Well, but it's not unique to you at all. That's a story that I hear all the time, and so what I tell you is just like any other drug. Nicotine is a drug, and it's a very addicting drug, very, very strongly addicting. So it does take a lot of work and effort to try to come off of it. But I would tell you the thing that almost never works is weaning down in any capacity. Well, I'm going to cut back. Well, what happens when you get stressed?
Yeah.
You don't cut back anymore.
Right.
What happens when a family member dies? You don't cut back anymore.
Yeah.
Because the cigarettes are what treats your anxiety, what treats your stress, what you fall back onto when things are not quite right. And who has a life without stress?
Right.
I always say if I could cure stress, I wouldn't have enough chairs I can put in my weight room. I wouldn't have enough parking spaces in my parking lot. Right. Baton Rouge wouldn't have enough parking spaces for me to be able to, to treat people if that was truly curable. So life is always going to throw you things. So weeding never works because it feeds into that process of when I don't feel right, I'm going to do that.
Mm.
And folks are what the most effective way is quitting. And what I mean by that, serial quitting. Because one time it sticks. Just go cold turkey. Because even if you go back, quit again. Even if you go back, quit again. And one of those times, it's going to stick. And that's what you have to tell yourself. And also, don't be shy about understanding why you smoke.
That's good.
Some people smoke because they do have an anxiety problem. Anxiety is truly a medical condition. It's not just this stigma that's put on it like, oh, I just need to think my way through it or get my way. In fact, that's what makes it worse, because as you think, the anxiety gets worse.
Yeah.
Because that's what it is overthinking everything. Yeah. And so we have to understand that, I have an anxiety problem. We talked about mental health. Mental health is often shunned in our communities, as you know. Yeah. So one thing that you need to do is, if you have an anxiety issue, you need to find out what you need to do to fix that. It could be just talk therapy, but it may be medical therapy, because there can be a chemical imbalance that's keeping you in that realm that makes you so uncomfortable that you have to do something to treat it. And sometimes it's bad behaviors, but one of those bad behaviors can be smoking.
Yeah.
And you're really treating the anxiety with the cigarette. That happens in alcoholism. That happens in a lot of addictions. If you notice people who try to quit, I don't know if you've ever gone to an AA meeting or gone to a meeting like that. Almost all of the folks smoke, because the transition to get off of the alcohol a lot of times involves smoking. or they substitute.
Right.
And it's like they trade one addiction for another addiction because it's still treating the same underlying problem, which is broken. And so and so you have to find out what your underlying problem is. And I tell you, you said one thing. You said you prayed, turn it over to God. That's true, because if you look at the whole tenet of the steps program,
Yeah.
it's about identifying there's a greater power than you that's going to help you resolve the issue you have. They may not call it God, but that's essentially what you make it. And if you are a Christian, it's going to be God for you.
Right.
So it's in that principle. You need to pray. If you are a spiritual person, if you have an anxiety problem, you may need to get some medicine to treat that, or whatever therapy is required to treat that. And the third thing, don't be shy about taking the assistance of the different aids that can get you off. I have used almost all of them, from the Wellbutrin, or what was called Zyban back in the day, but guess what Wellbutrin is? Anti-anxiety medicine.
Well,
That's why it helps people quit smoking, because it replaces that need for it. That's been the one of the reasons that helps. You can also do nicotine replacement, where you do, whether it's the gum or the inhaler or the patches. And so you can try to do that and have a process by which you wean and then get off of it that way. There's also other agents like Chantix. Those medications have been very effective at helping people to quit. Well, what I've found is the most important thing is your desire and dedication to quit and not make an excuse not to.
yeah.
Because if I give you any one of those things, if you're not truly committed, you'll let anything. Oh, that patch itches me too much. Oh, I don't like the way the gum tastes. Oh, the inhaler burns my nose. You'll find something. Or if the Chantix gives me bad dreams. Yeah, I say, but it's only gonna give you bad dreams for a couple of months. Right. Okay, you know what? I have bad dreams and I don't use Chantix. Okay, just understand that that's part of it.
And what's a couple months?
Yeah.
20 more years on your life.
Exactly. And you have to make those true assessments of who you are and what you are and what you're trying to do. And it requires a lot of introspection to quit smoking or do something like that, or get rid of any addiction. It requires a lot of introspection and understanding, what am I doing wrong and why am I not being successful at it.
Right. Yeah. And I know when I was smoking, when I stopped, one of the things that everyone I supplemented for smoking was food, specifically sugar. And I was in shape, or what I felt I was in pretty good shape anyway. I was lighter in terms of my weight. But as I began to stop smoking, I substituted again food, snacks, all this kind of stuff. So if I got an urge, instead of smoking, I would get a little Debbie cake or whatever it is, or maybe go get something to eat from the corner store type of thing. So I say that to say, for our audience to be mindful of that, so you don't spiral into one addiction to another. And I found myself spiraling from one addiction to another. And some people may not understand or know that sugar is addictive too. It's very addictive. It's another kind of dopamine driver, and I was addicted to, my wife used to say, you're not even eating, it got to the point, Dr. Green, I wasn't even eating food per se. I would eat maybe a meal or a sandwich, but for the most part throughout the day, and especially after COVID, as we began working from home, it was all snacks and sugar, and that just sent everything in a tailspin. So I say all that to say, be mindful, everyone. If you do have these type of addictions, seek the help and the resources that Dr. Green has spoken to, versus trying to mask it with something else, where before you know it, you're entering into another form of addiction. And Dr. Green, I got a question. So I was talking to some of my buddies about Men's Health Month, Men's Health Awareness, June, Men's Month, just excited and pumped about that. And I, expressed to them, that you were coming on. And one of my friends asked, and I asked my guest, how does this impact his sexual function or sexual health in him? obviously not going to give his name and his business, but he wants to know, does that have a parallel, if you will, being having heart issues and how you perform sexually, I guess is the.
The answer to the question is yes, it can, especially with uncontrolled things. Okay, lots of times, the major problems with erectile dysfunction when it's a medical or physical problem is the blood flow to the organ itself. And just like we can develop blockages in the arteries that go to the heart, you can also develop blockages in the blood vessels that go there. And so the goal of therapy is always to control those risk factors that can lead to that, which, are high blood pressure, diabetes, cholesterol, all of those things that we smoking are all things that can contribute to very permanent damage to those blood vessels or to that function.
That's it.
A lot of times individuals get caught up in the concept of, oh, if I take a blood pressure medicine, sometimes it can cause some erectile dysfunction. That's true. But a lot of that can be reversible, and sometimes we can change medications and do things, and or even treat it, with some other medications to try to help that work, as compared to if you don't treat the high blood pressure, it becomes a permanent issue that nothing will work for.
Mm-hmm.
So you have to understand that there's levels to it, and your failure to understand that is what can lead you to a worse outcome. The high blood pressure, diabetes, high cholesterol can cause permanent damage that you can't even take medicines that's gonna really help it.
Wow.
So that's why I tell people don't believe the hype that it's just the medicine cause it. No, it's the disease process cause it. And there are other conditions too where folks have very weak hearts, and that will contribute to your overall sex function because your physical ability to do it
Yeah.
can often be disturbed. But the key to that, again, is controlling that problem, treating it appropriately so you maximize your physical abilities. And then you can get to a workable area with that. So yes, it can be affected, but there are so many things that we can do to help that issue.
Yeah, that's good. That's good. I think that's, one of those areas men, at least I'll say, in my group of friends, for the most part, all of us between 40 and 55, our group of friends. And there's some of us in good shape, some of us in kind of okay shape, and some of us not in great shape at all. And these are things we talk about as we age. We have those type of conversations in terms of, you always want to perform at your highest level, but then age, diet, things that we take for granted kind of slip in, and then we're like, okay, what can I do to reverse this?
Well, and that's exactly right. Prevention, because you say, how can you reverse it? By not letting it be permanent. So that's number one.
Gotcha.
The other part of it too is I think that we don't take into account as much is the mental aspects of it. Okay, and I often will label erectile dysfunction as a family disease.
Mm.
And what I mean by that is when you're 17, it's a men's show, when you're 17, 16, 15, it doesn't take anything
Yeah.
for you to get just a thought.
Yeah.
A thought.
Right.
Okay. When you get older, it takes a little more.
Yeah.
And oftentimes, our times when we're more romantic and get set in the mood happens when we're younger, when it doesn't take much.
Yeah.
But when we get older, we get complacent and we just want to jump up and do something. And it doesn't quite work like that.
Yeah. Yeah.
And then it becomes mental. And it's like a mental thing that's stopping you from doing it. What I tell people to do, first of all, is you and your wife, girlfriend, spouse, however you do, need to have real communication about sex.
Understand?
The transparency is, I need a little help to get myself to where I need to be. So you need to go over to Victoria's Secret and get a little something. You need to set that mood with Luther. Don't become so holy that you forget that the bedroom is not defiled among married folks. You have to be able to still set the mood. You have to be able to still take that time. You have to take that time to have that intimacy with your partner. That's some of the major part that we miss, and we try to make it all just a physical thing. When it's not just all physical, it's more mental. Men are visual. We like to see. We like to think about it. We like to have, a lot of imagination when it comes to it. So that's what you lose when you get older because you just don't take the time to do it. You're working, you're busy, you're taking care of the kids, you're doing this, you're stressed, and then at night after you get done, you gotta go to work all day. You gotta come home. You gotta figure out how to get the kids' homework done. You gotta figure out what y'all gonna eat tonight. You gotta get a bath. Finally get dressed for bed. It's about 10 o'clock, 10:30. You say, okay, let's do something. Y'all just look at each other and say, let's do. She's tired, you're tired, and then you say, and before you know it, both of y'all just roll over and go to sleep because it's like, and then and if you try to do it, it's like, oh, it ain't working out for me. So you just go to sleep, or and then you get into a mode of feeling depressed about it. I don't work anymore. I'm not a man. I'm not man enough anymore. Yeah, the less that, and so then that gets into your psyche, and a lot of that is just emotional. A lot of that is just an aberrant behavior that comes because you didn't really take the time to really figure out what the real problem was.
Right. That's good. Is it an age range that men should be aware of that? Well, let me ask that a different way. In your field and during your years of practice, do you see where any culture has more heart disease than another? Is that African Americans?
It's definitely African Americans, Hispanic, Indian populations have much more heart disease than the other populations. Wow. But let me just start with this though. More people are going to die from heart disease than any other disease process there is.
What?
In fact, you can combine the top 10 cancers that people are much more afraid of, and more people are going to die from heart disease than the top 10 combined.
Wow.
That is the magnitude of where we are with heart disease. And, people got to die from something, right? It just so happens the major thing they're going to die from is heart disease. And so that's why it's so important to do the things you say at what point should you start checking? Well, first of all, the question I ask you is, when did the person in your family have a problem, if you do have a problem in your family? Okay. Number two is, when did you start developing all those other things we talked about? And what are you going to do to treat those, okay? So when you have 2 or 3 combinations of any of those disease processes I talked about, you probably need to be seeing a cardiologist. Everybody needs to see a primary doctor at least once, twice a year. But when you should see a heart doctor is whenever you develop a few risk factors and it's time to really focus on that prevention. We don't want you to wait until you have the heart attack or develop the heart failure or develop the bad rhythm problem before you come and see us, because it may be something that we can prevent or at least push back. You see, something you said earlier about quality, we talk a lot about that. So my focus is quality, okay? Because I'm a firm believer that quantity is God's business.
Yeah.
And we don't know. What they always say when you go, you don't know the day or the hour.
Yeah.
But I focus on how good you feel while you're here.
Yeah.
And I want you to focus on that aspect and then let the quantity take care of itself. Because that's something we most of the time can't control anyway. But there are some things you can do, but I tell people there are some things you can do to shorten your life. This is the Bible tell you the things you can do to extend your life. There are definitely things you can do that shorten your life as well. And if you don't take care of yourself, yes, those health issues will get the best of you. So that's why we need to do the things to make you focus on feeling good first. And then the second part becomes the quantity, because you're doing the right thing.
Right things, yeah. How effective is a person that has heart disease to be active? So if I have a heart issue, but I want to do cardio, am I able to? Or I have to kind of be in a certain area of exercise?
Well, no, typically we are strongly recommending exercise at almost every level, because the better your physical endurance is, the better you're going to usually perform and tolerate any sort of heart issue that you have. So our goal is to push physical activity, not limit it. It's rare circumstances that we're going to tell somebody to reduce.
Naturally.
how much they do. It's very rare circumstances, is that going to be the case. If there's something that's limiting your physical activity or ability to have physical activity, those are the things that we're trying to fix. Most of the time in fact, all of the time when I'm going to fix a blockage in somebody that's coming to see me, it's because they have some limitation that's stopping them from doing the things they want to do. And that limitation could be chest pain that comes on when they try to exert themselves, shortness of breath, they get it swelling or different things that we're trying to address in order to enable them to do the things that they want to do and gain the quality of life that they want to acquire. So yes, activity is one of the main things that we actually encourage and try to help to facilitate. I have a lot of patients that are octogenarians and older, and I always ask the question of what's the key. I can tell you, I've never seen a person get to 90 that hadn't been active their whole life.
Wow.
Never seen it. And they all tell you that. I always worked hard, I always moved, I always did this, and they never stopped. I never tell a person to retire if the job doesn't work them and they work the job.
Yeah.
See, typically when you've been at a job long enough, you should be learning how to work the job, and the job shouldn't be working you. At 65 and 70, the job shouldn't be working you hard. You should have learned to do. And so I never tell folks to stop exercising. I never tell folks to stop working, because it gives you a sense of value. It keeps you active, keeps your body moving. And the more you move, typically the healthier you're going to be. Yeah. And I always say the human body was meant to move. Animals were meant to move. I always use the analogy: what happens to a horse when he breaks his leg? He breaks his leg. They put him down. Yeah. They shoot him in the head. Yeah, that's what they do in the country. But they might go put him down. And, we put him down. We bring him to the vet. But this, that's a good. Yeah, we bring him to the vet and we put him down. But that's the same scenario, because once he's immobile, one of the worst things that can happen to an elderly person is to fall and break your hip.
Yeah.
People tend, if they can't be fixed, they usually try to fix it through all means, because you want a person, because once they're immobile and can't move, the time from that until they die is usually very short. The human, when it doesn't move, it breaks down. It breaks down. When you can't move at the level you want to, it breaks down. And from a lot of different ways.
So let me ask you about, and so over the last 2 years or so, we've seen, at least what I feel has been an increase anyway, of athletes of various ages, whether it's high school, college, or pro, that had passed out on the field, passed out on the court. LeBron James' son is one of them as of recently. Some of the audience may remember or may not remember, there was a gentleman back in the day by the name of Hank Gathers, who during a basketball game literally had a heart attack and died on the court. What do we need to know, or why is this kind of we're seeing an uptick in this? Because we're seeing it in soccer players, we're seeing them in basketball players, we're seeing them in it hasn't been any discrimination to it. It seems like we're seeing it in all sectors of sports.
Well, I would tell you, it's not that you're seeing more of it, it's that you're seeing it. See, things are just much more visible now because of social media, because of the way we get information and everything spreads. It's just that I was watching that game when Hank Gathers. I remember lying in my bedroom at home, watching that game for Loyola Marymount when he collapsed, and he just looked like such a innocent thing, like it was gonna be okay, and ended up dying. But it's not that we see more, but it's just that it's more televised and brought right in your face now because it's Bronny James.
Yeah.
You see what I'm saying? If it wasn't Bronny James, there's a very a great program that one of my colleagues that I used to work with, and among with some other people here in town, started many years ago, called Jumpstart Your Heart, that you have heard about it. They have a lot of they go around and evaluate high school athletes to look for specific problems with the heart by doing an ultrasound, or we call it an echo. They do EKGs and different things like that to assess, to see if you have one of those findings that may predispose you to having that. So the answer to how do we grab hold to that is we probably have to do a little more aggressive screening for people a little bit younger and athletes, and have much better physicals done, because some of those physicals that they have are so just, you know, cursory, generic, and do they really get a thorough evaluation? We need to really start thinking about how aggressive we should be. And I do encourage people, if you ever have an opportunity to support Jumpstart Your Heart, because I think it's a great program that really can help save kids' lives. Dr. Stephen Kelly and his wife Danielle Kelly are some of the are the two people that are spearheading it here locally for the most part right now. And no, it's a local. No, it's a local. It started after the death. I forgot the young lady's name. You may remember several years ago that died on the basketball court here. Can't remember the young lady's name, but that spurred them amongst other people in the community to say, we need to do something to try to change this dynamic. So a lot of individuals are getting helped, and sometimes they find some significant things that these kids are treated for, and you may not be able to play sports, but you're able to live. And so the key is to make sure we try to get the appropriate screening. So it's not really that it's an uptick. It's more of that we're just recognizing it because we see it. It gets put in our face more. But these are things that are being worked on behind the scenes more than folks know, because that doesn't get promoted as much. It's just the Bronny James going down. That's what you see. Soccer players, same thing. But think about soccer. It's the most popular sport in the world. So if you have that many people participating in a sport, you're going to have individuals that have these type of problems that is going to happen to. It's just that we never paid attention to soccer before. That wasn't something that was prompted in America. It's been the advent of the soccer mom. Americans, we're very ethnocentric. Look, if we don't dominate the sport, we don't worry about it. That's just how we are. Back in the day when I was having this conversation with somebody the other day, we were talking about the different sports and say it's only prominent for us if we beat somebody that's prominent. And so I remember when I used to watch Breakfast at Wimbledon and the French Open. I'd wake up in the morning, watch them on TV during the summertime and all this stuff, and we used to watch those sports when we had Chris Evert and we had Agassi and McEnroe, Agassi and Connors, and we had the Venus and Serena Williams, and when we dominated the sports, guess what? We watched them. Now that we don't dominate anymore, does anybody watch it? Because we're funny. Americans are funny like that, man. But I think the point I'm making is that we didn't pay attention to those sports that much, so we didn't know how much it happened. And you can imagine it happens a lot more in those undeveloped nations than it does here, because they probably have even less screening. And so we just never knew if somebody died in India. We didn't know if somebody died in Pakistan. We didn't know if somebody died in, wherever. But now, because it's becoming such an international sport where people are paying attention to it more in America, now we see it more because we're paying attention.
Awesome. This has been great, Dr. Green. Thank you so much for joining us today. Jumpstart Your Heart. If you're watching, you're listening, I am going to learn more about you guys. I'm excited to learn more about that. And again, that's locally here, right? Okay. So I may even reach out to you guys to come on to do some educational pieces for that. So again, Dr. Green, thank you for joining us. This has been very helpful. I actually want to bring you on again as we go into our men's conference, and I'll come more to come on that. But really, we're being very intentional and aggressive about educating our men, specifically black men of all races, but specifically areas where black men suffer the most in terms of the healthcare world. So definitely want to follow up with you on that. But is it okay to mention where you practice at?
Oh man, it's perfect. I practice. Yeah, I mean, I practice with Cardiovascular Institute of the South. We have locations across South Louisiana, actually a location in Mississippi, and we actually have a practice that we manage actually outside of Chicago, Illinois. We're one of the larger cardiology groups in the country, and we pride ourselves on practicing the most cutting edge, cardiology care, that you can have. That was one of the things I wanted to mention, is that one of my biggest things is we try to bring the most cutting edge, the most beneficial, the most risk reduction, the most technologies to our communities. You and we as black men have to be a little bit more open to taking responsibility of our health care, but also to educate ourselves on what we need and what's out there to be able to help us. We have to understand that you have to find physicians that you work well with, that you communicate well with, so that you can develop a plan that you trust and they trust. It's all called fidelity, right? We have to have fidelity in this relationship, that what you put into it, you get out of it. And so find that person that works for you. It may not be Dr. Green. It may be another doctor that you fit with, but whoever connects with you and you feel like you connect with is who you need to talk to. And never leave a physician's office not understanding
That's good.
what they're telling you. We often had that discussion with we never let my dad go to the doctor by himself because he would never come back with any meaningful information about what happened. He said, I don't know what that man said. Right. And that didn't help anybody, and that's the way. So we need to educate ourselves. We need to go to the doctor with our parents. We need to make sure as men, we talk a lot about sexual health because we get so focused on that. Right. But life is so much bigger than just that. Yeah. And so many more things that can happen to you. That makes you not even care about sex. Yeah. I'll be honest with you. You can be to the point where you don't care about it because there's so many other things that are bothering you because you haven't taken care of them. That becomes secondary. That's at the bottom of the list. So why don't we talk to each other about going to the doctor? Talk to each other about, going to see a cardiologist if you need to. See those doctors that can help you to get out of those tight spots that you might find yourself in.
Yeah. And gentlemen, don't be intimidated by asking questions when you're at the office. Even at this point in my life, I find myself, before I go to my doctor's visits, to really be intentional about asking questions, be intentional about listening and understanding before I leave. So don't be more vulnerable at your doctor's appointments. Be more open-minded. Be more open in general to pose certain questions. And it's okay not to know. It's okay not to know, because at the end of the day, the goal is for you to live a longer, more quality life. So, again, Dr. Green, thank you for coming. Dr. Green is at Cardiovascular Institute of the South, one of the largest cardiovascular providers in Louisiana. If you have any questions or areas of concern that you want to learn more about your heart health, do you want to give the website? What's the website for Cardiovascular Institute?
Cardio, CARDIO.com.
Cardio.com. Dr. Garland Green practices there. Go look it up, check it out, educate yourself, live longer, live better. Again, thank you for joining Guy Talk Pod. This has been great, where we are honest, open, and transparent. Follow us on YouTube, Facebook, Instagram, The Guy Talk Pod, The Guy Talk Pod. Until next time, see you later. Peace.